be educated, but I'm so frustrated.
Hello everybody, it's Dr. G. I hope everyone is doing well. So today, from the title of this video, I will be talking to you guys about fellowship match and after family medicine residency. From the title of this video, I matched into emergency medicine fellowship. I am super pumped. I am super excited about that. If y'all still remember, like several months ago or maybe a year or two ago, I think, I had made a video where I talked about, different interests right now because I'm in an unopposed family medicine residency program. So the options are really limitless. Like I could do basically outpatient medicine. I could do private practice. I could basically work in a group practice, right? Outpatient, or I could be a hospitalist. I could go do a fellowship. So that being said, initially I was kind of on the fence about it. Came down to either hospital medicine or emergency medicine just because I love both. But of course, as we know, my love for emergency medicine far out trumps that for hospital medicine. I had initially signed a hospital medicine contract about a year ago, but then I started thinking hard about it. I said, you know what? I really want to go do emergency medicine. Now, the thing for me is I could easily get out of family medicine residency and go work in the ER. But for me, I felt like I want to give myself that extra push, right? I want to give myself the opportunity to gain more experience, learn more, just be able to do more in the emergency room setting. So started researching for fellowship programs and stuff. Now, the American Board of Physician Specialties have different fellowship programs that are accredited where you can be board certified after you're done with your program. There are a lot of fellowship programs that you can do. So there is behavioral health. The top ones are actually emergency medicine, family medicine with obstetrics, right? So they teach you to do C-sections, so OB, those kind of things. But that though, it'll be catered towards you working like a rural setting where they have like not great supply like OB-GYN docs and stuff like that. So family medicine, OB, emergency medicine, sports medicine is also a big one as well. Also affiliated with family medicine. There's also sleep medicine, hospital medicine for those that want to be hospitalists and feel like they need more experience in that area as well. And some people decide not to do any of the fellowships at all, just go straight to work. So that was the option for me, either just go straight to work or go do a fellowship and gain a little more knowledge, clinical experience in what I'm looking to get into. So for me, I chose the option to go for fellowship. I started applying right as soon as I got into my third year, and most of the requirements they wanted were like my step scores and stuff like that, and then my performance in the residency in training exam, what we call the ITE. So they wanted to see my scores in that. And then the other thing too is like they wanted to see what you score like a step one, and then what is your program director and other faculty saying about you in the residency. So kind of like the same way when you apply to medical school and stuff, they really just want to see the entire package. Another big thing that's like super important when you're applying for like any fellowship programs beyond family residency is your commitment to the program. So people really want to see that. Like in my case, I showed commitment by going off to do extra electives in the emergency room. So when I interviewed with them, they could see that, okay, even though I worked several years before, like as an emergency room nurse and stuff, that also counts towards that commitment, because this is me now pushing for something that I have great interest in. And then now in residency also like getting these extra rotations and stuff as my electives in the emergency room, that also did show commitment. And when I interviewed, they were like definitely impressed with that. And let's not forget, another super intricate part is those recommendation letters, especially from your program director. So your program director's letter, like what he's saying about you, of course, does carry the most weight out of all the recommendation letter that you do obtain. But really, these are like the main things that I provided. And then, of course, I started to interview for it. Now, some programs will go through the match. So the same way that you go through residency match, apply, go through ERAS, get a token, those kind of things. Some of the programs will go through that. And then some will say, no, we don't participate in the match. And to be honest, it's so much easier because going through the match is just so much hassle, just unnecessary stress. So if you see programs that say we don't participate in the match and stuff, we just basically just do our own thing, invite you, do our interviews. If we like you, we'll let you know. If we don't, then and that's it, we'll move on to another candidate. But fortunately for me, I didn't have to go through the match. I was fortunate enough to match into one of the best programs in the country for emergency medicine fellowship program training for family docs and stuff. So I'm super excited. It'll be at University of Tennessee in Jackson. So I'm so excited for that one. It seems like it's going to be a lot of work. I had a tour of the hospital. It's just a beautiful hospital. I got to meet the fellows and talk to them about the experience, and the ones that were basically nearing the end of their fellowship program, they're like, listen, I would do this like 10 times over. It's the best decision I ever made. So it kind of gave me more confidence because I was like, oh, I'm glad I decided to do this, because I felt like I didn't want to just go straight out of family medicine, just go straight to the ED. I wanted to get that solid training, like solid. And my program is for 1 year. Most of the fellowships beyond family residence, it's usually 12 months or 2 years. A lot of the sports medicine programs are 2 years. The emergency medicine programs are between 1 to 2 years, depending on what program it is. And this schedule is awesome because I'll be working about 14 shifts in the emergency room. So the rest of the month, like half of the month, I do have time to like moonlight, make extra money on the side and stuff. Like you can moonlight in the same emergency room where you're doing your fellowship, or you can moonlight in like ERs and other parts of the state and stuff, like whatever you prefer. So I really like that. I know a lot of people say like fellowship schedules are usually more intense. I'm really excited about mine just because I looked at the schedule. I was like, yes, I can work with this. It's kind of like a usual like ER doctor schedule too, because most ER physicians, their schedules are like 12 to 13 shifts a month. That's like considered full-time, and of course the rest of the month you do with that as you please, basically. So that's really the long and short of fellowships beyond residency. Like I said, it's not mandatory, but it's really more for your own benefit as a clinician, especially if you're going to a field where you're like, okay, this is not the field where I basically practice every day, and I think I could use more clinical experience here. Then it's very well worth it in my experience. So, but we'll see how that goes. Of course, you guys know I will keep you up to date on that. I start fellowship like a month or two right after residency is done, because I do have to process like Tennessee license and get all of those things before I move on. So in between graduating from residency and the few months before I start fellowship, I'll probably just kind of spend my time moonlighting in the emergency rooms and stuff. And about the topic of moonlighting, so I have been moonlighting, working in other ERs since my 3rd year, but I will make another video to kind of tell you guys about that as well. So, and like I said, a lot has been going on, guys, but I'm going to go ahead and stop here for now. If y'all have any questions, please feel free, reach out to me and I will respond. Until next time, it's Dr. G.